what is surface tension? In the simplified terminology, the surface tension is inward force. It is the inward force which is present in your alveoli. Why there is an inward force present? Remember, when you were fetus, at that time, your alveoli were collapsed. Okay, but the blood supply was still going on. But at that time, one thing happens that this alveoli, they are going to get lined up. They are going to get lined up with a layer of fluid, a single layer or a simple layer of fluid. Now, the property of water or the fluid molecules are that they want to come together and form a one big drop rather than small, chote drops. Okay. If I drop the water over here also, what is going to happen? They have that cohesive force and the adhesive force. And because of that, they want to come together, right? And form one big drop. When they want to form one big drop, what is going to happen? That their adhesive and cohesive force is so strong that it will make the alveoli collapse, right? And why this is going to happen? Because inside there is a air, and outside or at the boundary of that alveolar wall, I'm going to have a water, right? And that's why your raindrop structure is also like this triangular shape. Why? Because there is a surface tension present. Okay, there is an inward force present in all those water molecules, right? Now, if I talk about why there is a surface tension and where it is present at the maximum. Remember, when there is a air-water interface, when the air and water, they are going to come together, air-water interface. At that point, definitely, the surface tension is going to be maximum. Now, surface tension is the inward force generated by this air-water interface. So please remember, if I finish this air-water interface or I try to break down this air-water interface, what is going to happen? See over here, 1, 2, like this, I'm going to put a lipids. And I told you yesterday also, and the day before that, when we learned general physiology, that the water and lipids, they are acting or they are having opposite properties, so they cannot mix with each other, right? And since the lipid is having the less density as compared to the water, it is going to come on the top of this water layer. When it is going to come on the top of this water layer, what will happen to the air-water interface? Obviously, the air-water interface is going to decrease, right? And what are those molecules? Those molecules are nothing but your surfactants. Whenever I add the surfactants, main surfactant is going to be formed by the lipid. That is nothing but your favorite one, that is phospholipid. And which is the main phospholipid? If they ask that, you're going to tell me, ma'am, it is DPPC. That is dipalmitol. This is phospholipid again. And DPPC is dipalmitol. Phosphatidylcholine. The another name for this is lecithin. Now, there is a second most common, that is, this is the first most common, second most common is going to be your sphingomyelin. As its name suggests, it is present in the neurons also, and that's why we call it as sphingomyelin. First of all, it was discovered in the CNS. Please remember that. Now, whenever I want to check the fetal lung maturity, you must have learned in the gynae that you do something known as LS ratio. You do something known as LS ratio. What is this LS ratio? That is lecithin is the sphingomyelin ratio. It should be more than 2 or at least equal to 2. That means the DPPC should be twice that of the sphingomyelin at least. Why? Because they are the main lipids and they decreases the surface tension to the max. But if the fetal lungs are not mature, will this ratio be maintained or it is going to decrease? Obviously, it is going to decrease. So when this first thing, that is your DPPC is going to decrease, what happens to compensate the sphingomyelin increases and overall ratio is going to fall. Okay. So in this condition, the LS ratio is going to be less than 2. What that indicates? immature lungs of the baby. Immature lungs of the baby. Okay, when this is going to happen, when especially the baby is born prematurely at that time, the surfactants are not properly processed, they're not properly synthesized to the adequate level, and because of which the baby is going to land up into something known as the respiratory distress syndrome. Respiratory distress syndrome, to identify that, to check that, to diagnose that, we do this LS ratio. Okay.